Welcome to My Healthy Mind. I'm Michael Hunter. Since the lifting of our state's stay-at-home order, we are back in the studio, observing all safe distancing precautions, to bring you a very important show. For all of us, these have been very strange, very trying times. Many of us have suffered firsthand, both physically and mentally, in this unprecedented test of our endurance. But for the African American community, the fallout has been even more devastating and more far-reaching. What with the coronavirus, escalating racism and violence, and a widening sense of hopelessness, desperation, and despair. Issues that have been simmering for a very long time, exacerbated in recent months by the outbreak of COVID-19, have erupted into a perfect storm. Our mission and our message here at My Healthy Mind from the very beginning has been let's talk about it. No subject concerning mental health has been off limits. And now, with all the headlines and the statistics on the mental health crisis among African Americans, how can we not talk about it? According to the most recent figures in Michigan, African American people account for 14% of the population, but make up 33% of the state's confirmed coronavirus cases and 40% of deaths. Nationwide, Black Americans represent 13.4% of the population, but counties with higher Black populations account for more than half of all COVID-19 cases and almost 60% of the deaths, according to the U.S. Census Bureau. There are a number of reasons for these startling statistics and for the events that have followed. We have with us today three esteemed experts to help us understand why African Americans have been hit so hard by COVID-19 and what we can do now to help. We have with us Kevin Fisher, Michigan's Director of the National Alliance on Mental Illness, NAMI, Dr. Carmen McIntyre, psychiatrist and physician, and Leon El Alamin, community activist from the Flint and Genesee County areas. Welcome to My Healthy Mind.
Thank you.
Thank you.
So now that we're safely, socially distant, let's get started. Mr. Fisher, you made a request to My Healthy Mind and asked us to do a show regarding this topic as soon as possible so that we can get the message out about the urgent crisis with mental illness among the African Americans. Why did you have us do this show?
Well, it became apparent to us at NAMI, Michael, almost immediately when we realized that COVID-19 was a pandemic, that it was disproportionately affecting the African American community. The mental health effect of COVID-19 has put an enormous strain on the entire population, but uniquely in the African American community. And I thought it was really important that we address this as soon as possible.
So Dr. McIntyre, from a physician standpoint with the patient population in psychiatry and physical health, have you noticed that disparity as well?
Oh, absolutely. Very early in the pandemic, once it hit the United States, we noticed that amongst the African American population, we had more cases of people getting sick. The folks that were getting sick were much worse off. They had more severe symptoms, and they were getting hospitalized and dying much more frequently than the white population.
And Mr. El Alamin, as a boots on the ground activist in the Flint area, what have you been seeing among the people that you serve?
I noticed a lot of relapse and deaths occurring in the urban community in particular amongst a lot of the clients that we serve, returning citizens and so forth, who already have poor conditions of health prior to being incarcerated, while incarcerated, now returning back to the community on top of this health crisis. And as well was, I noticed as well with Flint, we already were dealing with a health crisis with the Flint water crisis. So you put that layer of health crisis on top of this COVID and the numbers have skyrocketed.
And how is the information reported? So when we say, when Mr. Fisher said, and you just said, hey, we started learning that this was happening, where's that information coming from?
That's just coming from the testing data, okay? So you get tested, and then that's reported to the local health departments, and then those health departments report it up to the state. We believe that it's at least 50% underreported. So these disparities are just from the cases that we know about, but we think they're hugely underreported.
And so what are people doing? Are they running to the doctor? Are they not going to the doctor? Are they going to social community services for help?
There's a long history. I mean, you think about the Tuskegee syphilis experiments and things like that. So there are a lot of reasons why African Americans don't trust the healthcare system. And when we do get into the healthcare system, there's implicit bias. So we don't always get the same level and the same quality of care.
You know, unfortunately, it's kind of like half and half. You have some individuals who taking it serious after continuing to see the reports coming out following the deaths and things like that. But you do have a large segment of the population that still hasn't taken it serious just because of those reasons that was mentioned, because of Tuskegee, the lack of health and coverage and things like that. They continue on with their lives as things as normal. I see it a lot of times, especially around the group of 40 and under. Large crowds are partying, you know, going to the beach, doing these things that we would normally do without COVID. We see the deaths, we know the effects of it, but yet you still have individuals who want to be defiant, who want to protest, who want to, you know, not wear the mask and do the social distancing and things like that. So we have our hands full.
And when people want to protest and get involved in the other aspects of life, what does NAMI say to them as far as how do you do that and remain safe?
So we encourage people to do it as safely as possible. We encourage people to social distance. We encourage people to wear your mask. We encourage people to wear their gloves. We have to constantly reinforce that we need to take this seriously. We need to, as I always like to say, control what you can control. And I understand the need to have your voice heard. And if that is in the method of protesting publicly in the street, I can't tell you to not do that. I can simply tell you to do it as safely as possible. And I think what we've seen in some recent numbers is those outside social protests, the experts or the information I've seen has indicated that those kinds of protests haven't necessarily driven the COVID infection numbers up. It's those indoor, close, tight spaces that are more contributing to it.
The CDC and, you know, Dr. Fauci, the leading expert on infectious diseases for the US, are saying here are the things that are associated with worse outcomes for COVID: diabetes, obesity, hypertension, asthma. What's the group that's most likely to have those health conditions? African Americans. Why? Part of it is because of socioeconomic status. You have to live in inner cities where there's more pollution and you're going to have more risk for asthma. You have poor access to quality food, you know, et cetera. So you're going to have hypertension, you're going to have diabetes, and that makes us more vulnerable to the bad outcomes.
Do you think that knowledge is fueling people to behave more responsibly or to have a knee-jerk reaction in anger and bad behavior?
I would say the knee-jerk reaction, because we continue to see the protests, we continue to see these gatherings, large gatherings and so forth, where you have some may have masks and things like that, but many people are still just angry, upset about the whole situation, about what's going on, whether it's from police violence to the COVID and many other things as well.
Well, yes, in the community, because unfortunately African American community makes up a large part of what we've now tagged essential workers, which are lower wage hourly workers, because we are disproportionately taking public transportation, because our community is still very heavily influenced by, we have a need to be at church with our friends and socially interact. We've not been able to, and in some cases willing to, follow those guidelines, which has disproportionately affected the African American community as it relates to COVID-19.
So you have a large segment of the population that already didn't have access to proper education and being informed on things that can assist and improve their health and overall well-being. Now you add this COVID and these other health issues on top of that, so they're still not getting the proper information, and they're just going along with their lives, and it's basically like they're just existing. And that's why it's being so affected by it as well.
And then sometimes, for many of us, we feel like we don't have a choice. As Leon mentioned, sometimes I just need to live today. I can't worry about tomorrow. And that's a huge part of what African Americans have lived with in this country for a long time. We don't focus on tomorrow because we are just trying to survive today. And for that reason, sometimes we don't listen to what the doctor tells us to do. We don't eat healthy. We don't take our medication as they tell us to. And so when Dr. Fauci and the other scientists come along with COVID and say, practice social distancing, we don't take that seriously. We look at it from the perspective of, we've survived so much, we can certainly survive this, and I just need to survive today.
And that's something I think us who have knowledge of this have to do a better job of reaching these folks, communicating the true messages out there, getting out there to inform the folks that still believe these type of things, that, hey, no, this is a different type of monster and it's really killing us, and we have the data and the science to prove it. We have to make some changes. We have to do some things differently.
Someone once told me that they believe that poverty should be a diagnosis. And with that as a backdrop, what do you think the coronavirus and its effect on the African American community should be?
Well, not just specific to the coronavirus, but how it's disproportionately affected the African American community. I'll go to a statement my CEO recently made, and it simply says that America needs to recognize that racism is a public health crisis and all that comes with it. So all of the things that we're talking about affects it because of the effect that race plays, or the role that race plays. It disproportionately puts African Americans in a position that makes us more susceptible to contracting diseases or viruses like the coronavirus and lead to the worst possible outcome.
For centuries, and definitely for decades, African Americans have felt helpless and hopeless. We don't go vote because you don't think it's going to make any difference, And as Kevin said, we kind of just try to live for today because you feel like we don't have a voice. And then when you take on top of that, now we're stuck in our homes and there's this COVID stuff and everything else, we explode. And as you said, sometimes we're our own worst enemy and we're destroying our own neighborhoods. But after, decades of you can't do anything, and you suffer in silence, at one point, it just goes.
Stress, depression, and severe mental illness can happen to anyone. Team Wellness Center has been helping those struggling with these conditions in southeastern Michigan.
They get a chance to know that somebody's on their team.
We think nobody else feels the pain that we feel. We feel like I'm the only one, but that is so untrue.
Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery.
Working through my problems and seeing that I'm not the only one that has to cope has really brought me to a place where now it's okay to talk about it.
Because if you keep stuff to yourself, you can't overcome. We all need one another.
Team Wellness Center. You are not alone.
We started with COVID, and then we had the George Floyd situation, and that was pouring gasoline on a fire. And I understand the people in America, quite frankly, the white community, who says, we don't understand why you're rioting. We don't understand why you're burning down your own community. What did Dr. King say? Rioting is the communication of the unheard. And so on the surface, it doesn't make sense because none of this makes sense. This whole issue of race in the United States doesn't make sense. And it was a powder keg that was ready to blow. And when you don't feel like your voice is heard, and when you don't feel like you can trust your public officials, when you don't feel like you can trust law enforcement, when you don't feel like you can trust the doctor, what else? What else do you have left?
But your rage. Just to add on to that, when you speak about the uprisings, the burning down of buildings and things like that, that comes from being, isolated, for over 400 years. If we want to go to the 60s, or we want to take it even further back from the plantation to now, so all that rage is embottled in. And like you said, it's a powder keg. So when we see these events, it takes us certain things to push a button. And that's what you're seeing. You're seeing that outrage. It's not necessarily just from the COVID. It's from systemic racism, which is at the root of all of this. People are fed up. So it's not necessarily just the COVID. This is just over 400 years of being cast out, being dehumanized, and things of that nature. And that's what you're seeing.
So the polls are now showing that mainstream white America, or non-African American Americans, are starting to recognize and admit that the disparity, the racism, and the negative impact of it is real. And not just is real, has been real, historically real. And they are responding to it and rallying in mass like we've not seen it before. Unprecedented, right? So what is that going to do for the African American?
Well, Michael, I think it's absolutely an opportunity, and I think it's an opportunity we can't afford to miss. I look, unfortunately, at the death of George Floyd as our generation's Bloody Sunday. And if people will look back to 1965, when the marchers were trying to cross the Edmund Pettus Bridge, that was white America's opportunity to see the brutality that African Americans were faced with. And then, like now, we saw white America say, we're gonna go and march with you. With seeing George Floyd murdered live on television, I think white America saw it again for our generation. And for that, African Americans have to be open and receptive to having this conversation. It's a difficult conversation. It's not just difficult for white America, it's difficult for us too. But we have to view this as an opportunity, because nothing will change if we allow this to be us against them. If we allow this to be, you've had your knee on our neck for the last 400 years, so let's switch places and let us put ours on your, that's not gonna work. What's gonna work is us all recognizing that America has and has had a very serious racial problem for a very long time, and only together can we resolve this.
I think it's going to have to be a combination of both, as everyone had mentioned. On one level, the oppressor has to be open to the conversation, but that conversation can no longer be from me talking to you and telling you what we feel is best for you. And then it's going to also take those who are being oppressed to continue doing what they're doing, to have those voices heard. And then once the protest and the marching slows down, then we have to be at the table, and the right folks have to be at the table. Because when all this is said and done, when even our white allies go back to their communities, when the sports and things pick back up and people have different things to get involved in, that's gonna be the real test, because those blacks are going right back to those ghettos, those unhealthy environments, the lack of water and resources and all these other things we know that's been poured up on us. So this is the reality I gotta go back and live with. I'm not coming home with you when the rally and the protest is over. So we have to be looking at what is the community benefit. And I think it has to begin to be implemented in stages. You have to begin to bring good paying jobs into these communities, better schools and education systems that cater to the individuals that it's serving and things of that nature, if we're really serious about creating systemic change. Because if not, it's just a feel-good moment. We've been dealing with this since the last president and the president before that, and it's a reason, because it's a combination of things. Laws gotta be changed across the board, from the state to federal to the local levels and so forth. And then mentality's got to change. So the education has to be in the school system about racism. We got to teach our kids at an early age because it's something that's taught. You know, you just don't wake up and come out the womb and say, hey, I don't like you because of the color of your skin. So it's a combination of things that we have to do. But definitely, I think it has to be both parties at the table looking at each other as human beings and not 3/5 of a human being. But I'm a man just like you and she's a woman just like you, et cetera. And let's have this conversation. How can we best serve and help each other so we can have more of a balance across the board?
And as we try to gain and achieve that balance, what do you think the African Americans need to do most immediately in regards to coronavirus?
We need to follow the recommendations that Dr. Fauci and the CDC and, our MDHHS and the governor have been putting out there. I mean, we need to be alive to try to get in place all the things that Leon's been talking about. And we need to keep others in our community live long enough to do that. So you gotta wear your mask and don't wear it below your nose and, don't wear it hanging off an ear. You gotta wear the mask. You gotta keep that 6 feet of distance if you can. And you have to demand testing. And it's not just if I feel sick. It's if you feel that you have been exposed, or even if you haven't been exposed, if you have the kind of job where you're going to be around a lot of other people and all these other things can't be, observed, demand the testing.
Go ahead, Kevin.
Well, I was just going to say, we can't take our health for granted anymore. We can't let the social disparities push us into that corner where we're just living for now. We have to recognize that we have families and legacies that we want to support, and we want to live long, productive lives, and we want to be there for our children and our grandchildren. We have to start with us. Yes, as Leon and Dr. McIntyre have mentioned, this is a big issue that's not going to be solved overnight. But I'll go back to, again, my favorite saying, control what you can control, and let's not take ourselves and our health for granted. We need to move past the stigma that seeking professional mental health care is a sign of weakness. It's not. We need to value our behavioral health because it affects our overall quality of life. And so I encourage everyone, but specifically those of us in the African American community, to seek mental health care. If you're feeling depressed, anxious, or something more serious, don't assume it, don't accept it as a sign of weakness.
And so, Leon, from a social perspective, what do you think the African American response should be?
Well, I definitely think it has to be a combination of things. There has to be resources poured back into the community that individuals can access. There has to be education that takes place with those resources so that they're properly utilized and used. There has to be a form of mentorship. You need some individuals, boots on the ground, that can walk with them, that can guide them and show, hey, I'm taking these steps. This is how I'm getting beyond this, whether it's COVID or whatever the issue may be at the current moment. You should try this as well. We're here to help you get through these things and so forth.
And so, given all that we've learned, whether it's because of the information that we've gleaned from this show or prior to, what would your final words be to America and anybody that's watching this program?
So I think kind of my mantra is all of us have to take care of ourselves in a holistic manner. So it's your body, and we've been talking about we're more at risk because of diabetes and hypertension and whatnot. So we have to take better care of our physical health. We have to take better care of our mental health as well, because that has physical consequences. But we also have to address our spiritual needs. And that's not necessarily religion for everybody, but you have to have a purpose. You have to have something that gives you hope. You have to have something that gives you a reason to get out of bed every day.
Kevin?
For me, it's all about mental health with me. We really have mental health resources available in the community. It doesn't matter what your economic status is. Michigan has a public behavioral health system called the Community Mental Health System. We always say there's not enough resources, but there are resources. So don't think that you need a lot of money to seek behavioral health care.
Leon.
I would say we have to value ourselves a lot more, regardless of our circumstances and situations. It's a lot of information out there, and you're right, resources and things like that. We just have to tap into it a little more. And then once we tap into it, we have to utilize those resources. We have to get those resources to our families and those closest to us and so forth. So for me, it's about valuing your life, regardless if someone is on TV asking me to do this or so forth, or a doctor or whoever. I have to value my life as an individual first and foremost. If I don't want to help myself, there's no one who can help me.
My job was causing me so much stress.
I felt disconnected and frightened.
I felt so isolated.
I was beginning to feel trapped, depressed. I never expected that to happen to me.
We think nobody else feels the pain that we feel, but that is so untrue.
It's good to be able to talk about it.
I was able to seek help. I found it from Team Wellness.
It's a sense of freedom.
Team Wellness Center. You are not alone. At Team Wellness Primary Care Center, you will find all the basic services you need to be well and stay well. Come in for all your screenings. Come in for routine physicals and checkups. Come in for full-service dentistry. Come in for vaccinations and immunizations. At Team Wellness Primary Care Center, we take care of your total health. Team Wellness Primary Care Center. Come on in.
Thank you for joining us today as we explored the developing mental health crisis among African Americans. If you'd like to learn more about this or any mental health issue, please visit us at myhealthymind.com, follow us on Twitter at myhealthymind, or on Facebook. We'll see you next week for another edition of My Healthy Mind. Let's talk about it. Thank you for tuning in. If you'd like to see more of My Healthy Mind, be sure to click subscribe. Are there any topics you'd like to see discussed on My Healthy Mind? Be sure to leave a comment below and let us know.